meeting. We have some apologies for, well, meeting protocol. So if you can remain on mute, please, unless you want to say something, and try and raise either a real hand or a virtual hand, I don't mind, before you speak. Apologies from Kathy Hadley, from Teresa Grant, Nick Hadley, Stephen Mould, Councillor Fiona Baker, Darren Dovey, Alan Burns, Kate Brown, Ian Vincent, Krishni Waring, with Maria Wogan attending, and Will Pope, but Kate Holt attending on his behalf. Notification of requests from members of the public to address the meeting. There are none. So we can move on to item 3, which is declarations of interest. So thank you very much. No declarations. That's very, very good. We can move on. Colin Foster to present the Northamptonshire Children's Trust plan to the board. Colin, you've got to be away by 10, but I think you've got enough time now and our attention. So over to you, Colin.
Great, thank you, Nick, and thank you all for accommodating my request. Would it be helpful if I shared screen? Because I think everyone's got the plan itself, but I've got sort of a brief overview presentation that sort of gives just gives an idea of the flavour of it.
Yeah, it's fine with me. Have you got sharing rights, Cheryl?
Just checking.
Yep, off you go.
Oh, hang on. There we go. Can everybody see that? Yeah, seeing nods, that's great. Thanks, everybody. So thank you for the time. This is, I would hope that most people on the call have seen an iteration of this, because the feedback from everybody in the development of the business plan has been very much appreciated. At the outset, I'd say that the arrangement between the Department for Education and the councils has been that we're required to do a 1-year business plan initially. Because normally I think when you see a business plan, it would be 3 to 5 years. And so just acknowledging that early on. But what I can assure you is a lot of the future thinking is contained within here, and we will bring forward a 3-year plan as we have to do next time. So I ideally would like to have done a 3-year plan now, but this is where we are. But I hope it gives a flavour of where we're at. So I thought it would be worthwhile for the partnership to give an overview of how it works between the council and how it will work with the councils and Northampton Children's Trust, because I've had a lot of questions, and do you know what? Coming into this new, I can see why, because it's not the clearest thing in the world. So hopefully I can give a little bit of clarity on this slide. So just on the left-hand side, you can see it says Northamptonshire County Council, of course. That will be West Northamptonshire and North Northamptonshire unitary authorities. So in terms of responsibilities, within a children's services function, you can group the responsibilities into 4 key areas. And those 4 key areas are education, special educational needs and disabilities, children's social care, and early help. And all the other stuff fits within those broad 4 headings. So fundamentally, unitary councils will be delivering education and special educational needs and disability, or will be the lead for those. And in the Children's Trust will be responsible for the lead of children's social care and early help. But does that make sense? There's a basic split. Now, just to be really clear, that doesn't mean that we're not all part of the network, and particularly, the education and SEND input into that is essential, but it's just where the leadership sits. And of course, in terms of early help, Clive Seal has a paper later today. I've been really blown away by the partnership approach to early help here, and excited to see how we can evolve that. So hopefully that's helped give a bit of an overview. I'm happy to obviously take any questions at any point. Anyone's got any thoughts about that? This is our vision and logo. The thing I'm really pleased with about this is that this was designed by children and young people. So we're literally on Zoom. There was a designer there, a group of children and young people who, I was on a roll then, sorry everybody. Yeah, there's a designer there, a group of children and young people sort of went, and they tweet this a number of times. This was then was shared with the wider partnership, shared with all our staff, did a number of sessions where we're over 700 staff each session to sort of develop this. And I think we've broadly got to a place where it's something everyone can understand and relate to, which is I'm really encouraged by that. So thanks for your support. How that fits in with our strategic framework is our vision of children, young people and families at the heart of all we do, in every action we take and every decision we make. I said that in one meeting, they said it sounded like a song by the Police, but at least if it's memorable, that's not a bad thing. The next on our strategic framework document is our commitment. And we actually sat with a group of children and young people in care to develop this, because it's quite a complex one, isn't it? It's what do you want us to commit to you? And I think where we got to is quite powerful. So our commitment to children and young people is what we do today affects your tomorrow. We promise to walk side by side with you. The outcomes framework there is something everyone would recognise. That is, there's obviously performance indicators within each of those 4 outcomes. And then our conditions for success. That's the jigsaw pieces of our workforce and how we work together. And of critical importance in that is partnerships. There's more definition in the business plan. And as we do our workforce development strategy, that will be fleshed out a little bit more. But the message, just to be clear to everybody here, the message that's been given out to our workforce is that we have to be effective partners within our partnership work. So that's through Health and Wellbeing Board, that's working with the police, that's working together to safeguard children. So that's my expectation of our team and commitment to you, really. Just a reiteration of that commitment, what we do to stay effective. I do like that. I'm not going to read through this one, but just noting that they are these are quotes within the business plan, but they're quite powerful and well worth a read when you get a second. For example, many of us have had a hard time with the one life we have. We just want someone to help us through. These are actual quotes, and I just thought, sometimes you can do a business plan. It's all about numbers. Now the numbers are important. Don't get me wrong, but actually, this is why we're here. And we're all in our partnership. We're all corporate parents. So at the bottom there, the best corporate parent you can be, and really open to any thoughts, initiatives people have about. I've already had a number of conversations with Nick and other colleagues about how we can work to support children and young people in care, but also care leavers. Apprenticeships for care leavers, etc., etc., etc. So if anyone's had any of those thoughts, please just reach out and we can build a conversation. My hope is that by the end of summer, that we will have a really coherent offer for care leavers that is across the partnership with, apprenticeships and mentoring and so on and so forth. But obviously, we're doing a bit of work on that, so we'll reach out. But if anyone has any initial ideas or contacts, please do shout. This is in the business plan itself, and it's probably my favourite bit because this was written by a young person who was taken into care at age 9. She's now 17 and a half. So you think that the poem's just incredibly powerful. So whenever I show this, I just be quiet for a minute and let folk read it, to be honest. And I always kind of, I don't know, it's one of them moral things again. I always make myself read it every time I'm doing presentation, so it becomes, I don't lose the meaning. If we were ever unsure why we do what we do, it's this. And also the work of a number of professionals, and this particular young person, obviously I won't go into name and details, but has worked with a number of our organisations, certainly with health, a number of health partners. And the fact that our system, our social workers, our health professionals have enabled a young person to get to a place where they've been through some traumatic stuff to articulate what's happened in such a coherent way, I think is incredibly powerful and a real, for me, it shows how strong the partnership is. So that's quite powerful stuff. And I have to say, just that the young person who wrote this, what this isn't is we say, oh, thanks for that. We'll just go and print it in a business plan and we'll take your work. This is a piece of art. This is a poem that someone has written, and therefore they've been appropriately remunerated for that as well. Our values, be child focused. I won't read them all out. They're very clear, but again, I think these are in kind with the values of all of our organisations. So, our commitment is to our partnership. And that was the best way I could express it, really. The last bit is just, I ask people to do the best job of your life every single day. And I promise I will. Do we always get it right? I don't know, maybe sometimes don't, but just keep on doing your best is my message to the team. And these are our priorities. So these are the priorities that are linked to the Ofsted improvement plan. They've just been changed a little bit to just give them a bit more, frankly, passion and motivation as opposed to being dry. Because we've got to be effective leaders. We want the best possible workforce. We want healthy partnerships. So this is writ large in the business plan. That's very briefly. That's just for information. It's in the plan itself, but it's an overview of who's who. So if anyone is ever struggling to find anyone in our system or who do I speak to or whatever, I think everyone now's got my email address and my mobile number. Just let me know, and I will definitely be able to point you in the right direction. And that's why we do it, because it really matters. So. I hope that's okay. And Nick, happy to take any questions.
Great. Well, thank you, Colin. Thanks for keeping to time as well. Colleagues, comments or questions or clarifications for Colin? We've all read the report, Colin, so you can take that as done. David, and then Joanne. David Watts.
Thanks, Nick. Thanks for presenting that, Colin. Just a couple of comments that I'd make on the business plan. You've got a page, I think it's section 2.7, where you talk about our current performance. One of the bits which I struggle with that, probably being more of a lay person around children's services, is it doesn't tell me whether those are good or bad. Those current performance levels, so there isn't an element of benchmarking in there. And then I don't necessarily see how that flows through then to the contractual performance indicators. So I'm not suggesting that's changed now, but certainly as we move into developing a 3 to 5 year plan, it would be good to look at those and understand, you know, are some of those performance indicators an indication that we're doing well or not so well. So more of the so what's around those. But I think the plan looks really good, and I think it's got the right ambitions in it.
David, thank you for your comments. And I think the 2.7 in its genesis was about just trying to give an idea of the scale as opposed to a contextual cutback. But yeah, I think that's really good. And also, when we come to the next one, we will have had a run of the performance indicators. So there's 21 performance indicators for the trust that will be in the appendix. So we'll be able to give an update on a clear update on performance then, because of course we didn't know it at the point of writing this, but it's a really good point, David, and thank you for your feedback.
Okay, thanks, David. Colin. Joanne.
Thank you. I think this is a particularly good time to be talking about this as we hopefully emerge from lockdown. I think it's becoming very obvious to those of us who work frontline with families, the sheer range of complexities that have developed over the last year. Some families who have managed previously pretty well actually are really, really struggling at the moment. And there are a lot more dynamics. So I think this is a really good opportunity to focus on young people, the difficulties they have and the opportunities. So I think it is a good opportunity. One minor style point, I suspect that the children who designed the logo are not aware of the genocide significance of the yellow 6-pointed star, which I personally found a little bit distracting. I'm sure that they won't be mindful of that, but just from a presentation point of view, that was just a personal comment, not to detract from the point of view of actually this is really important. The words are really important, and actually we're going to have a lot more emerging problems. The problems we have now will not be the ones that we went into COVID, just the ones we went into COVID with. There's a whole host that I think all partners are going to be aware of as we move forward. So thank you for presenting it. Thank you,
Joanne, and I did say that point loud and clear. In the refreshed version, we'll certainly review and look at that. I think, yeah, and Naomi, I noticed you support that comment too, and I agree. And yeah, it's yeah, thank you.
Yeah, thank you, Joe. Good comments, Lucy.
I just wanted to say thank you really to Colin. I think a number of us attending this meeting, but certainly a number of wider partners as well, have had the opportunity to comment on the drafts. And I certainly haven't seen that level of engagement in developing a strategy, and as you say, a very short-term one for quite some time. And I think, you know, we need to take a lesson there. It's, I'm sure, been laborious for you to get it circulated, but I definitely feel like we all own a little bit of it. And I think obviously that's the ambition of the trust is, yes, I recognise you have a statutory responsibility to the children, but as do we all as part of this system to make sure that we give them the best start in life and support all of their needs as they transition into adulthood. So I just wanted to say thank you for being so inclusive in the development of the plan.
Thank you, Lucy. Naomi.
Thank you very much. And obviously, I really applaud the involvement of children and young people. What I'm curious to know, because I hear this all the time about how they've been involved, did they tell you anything that really surprised you and thought, aha, we didn't think that, we need to do something different?
Well, as you may or may not know, colleagues, and I'll pop a link on the chat actually. The last Ofsted, we had an Ofsted visit, as you know, a few weeks ago, and the report's been published today. And they actually cite our inspirational Children in Care Council, and I assure you that they keep us on our toes. So
no, I'm just asking for a specific example of something that they said that you thought, aha, didn't think of that. Great idea. Let's do something different.
Yeah, it was that. It was.
I may not have any, but I'm just curious. I think that's
definitely.
The
do you know what was the biggest light bulb moment? It's not. Most light bulb moments are quite obvious when you say them out loud, aren't they?
Yeah.
And it was when we were developing the commitment, and it was like, every decision you make affects our lives forever. That's the decision to engage a child protection plan. It's a decision to take a child into care. It's decisions on placement, and it was just that clarity that every single decision matters. And although when I say it out loud, of course it does, but it was just when to say it in such a succinct way, and it absolutely hit me right between the eyes. I have to say, they're amazing.
Thank you, Colin. Any other questions for Colin? I know you've got to get away soon, or use the chat. So Colin, you're going to post some stuff into the chat for us to look at.
Yeah, I will do. I'll just pop the Ofsted report link on there, and I'm so sorry I have to dash, but thank you to everybody.
Well, no, thank you to to everybody who's looked through the 1 year tactical plan. Really, I guess is not quite a strategy, but brilliant work. Thank you so much for putting it together. Well, the board are asked to endorse the business plan and approve it in accord to the requirements of the service delivery contract, which I'm sure has been done. So, unless there's anybody who doesn't want to approve it, we can give you its blessing, Colin, and wish you well at your meeting at 10 o'clock. Great. Okay. Thank you, everybody. We can move on back to the agenda. We have item 5, which are the minutes from the meeting on the 14th of January. Are people happy that they're an accurate record? A few nods. Yeah. Thank you. Thank you, Matt. Thank you, Lucy. So actions arising from the meeting on the 14th. There are 4 of them. Lucy Whiteman, Peter Lynch, Cheryl Bird to review the joint NHCP Health and Wellbeing Board risk register. Once the Northamptonshire Healthcare and Wellbeing Plan is published, I think this action is closed. Lucy, the joint health and wellbeing strategy will be discussed later in the meeting, and the new boards in June. Is that an accurate? Okay, nodding. Thank you, Lucy. An update on the lack of AMHP provision to be brought to the next meeting. That's completed, but Adam Smith will provide an update slightly later on, I think under item 16. Lucy Whiteman, future of Health and Wellbeing Forum. Lucy will discuss with Naomi and Alison Gilbert how these forums can be used so they can support and be factored into the new county footprint infrastructure moving forward. I mean, is there a brief update on that, Lucy? You wanted to say anything?
I'm happy to, and Naomi or Ali may want to interject. Obviously, we're going to have an ICS update on the progress that the county's made in that regard. And part of the discussions as we design the shape of the ICS going forward is understanding what our geography looks like. Obviously, the Health and Wellbeing Fora had developed very organically, and they were never part formally of the Health and Wellbeing Board. So at this point in time, obviously, with the abolition of the boroughs and districts, that geography in kind of legislative terms doesn't exist anymore. And therefore, those groups are deciding amongst themselves whether they want to continue to meet informally. What we do still need to do as part of the ICS development is understand the new geographies under the new Health and Wellbeing Board and the unitary footprints. And it will be at that point that we're able to re-engage with those representatives to understand how they might be able to contribute into planning, etc. at that level of geography. So it's a little bit of a vague answer, but it's going to be part of a continued system sort of development plan.
Yeah, I mean, there's massive goodwill amongst those group of individuals. It's how that energy is channeled in the most appropriate way in the next iteration. I mean, Naomi, did you want to say something on that? Okay, thank you. Alison?
Comment later.
Okay, thank you. Okay, unless there's any other comments on that, we can move on to item 7, which is Health and Wellbeing Boards, a verbal update from Councillor Golby, summary of progress and post the 1st of April 2021. Matt.
Yeah, well, thank you, Nick. And as you mentioned at the beginning, today is the last version of the full fat version of the Northamptonshire Health and Wellbeing Board on its current footprint. And I was asked to do a bit of a summary of perhaps the last 4 years, the last cycle. And I was trying to think of appropriate words given everything that's gone on. And, you know, words like tumultuous, you know, it's been huge, hasn't it? From a political level, we've had all the issues at the county council come out to the fore, going back to 2017-18. The announcements in terms of local government, the reorganisation, how we're going to now have a Northamptonshire North and West new local authorities, the abolition of the districts and boroughs and the county council, of course, and then of course COVID, and I'll come on to that in a minute if I may. But to me, I see change, and I know many amongst us here, as a real positive driver. It gives us a chance to rethink what we're doing, what we represent as a health and well-being collective, and of course what we want to provide for our residents. And that's why we all come at it from a slightly different angle, but that's why we're all here, to improve people's outcomes, improve their lives, and try and represent them the best way we possibly can. And I really do think if we embrace that positive energy you just referred to, Nick, that's got to be our driver as we move forward. I guess we've got to thank all the partners that turn out to the health and wellbeing boards and all the different subgroups that fall away below that. And again, everybody has been absolutely amazing over the COVID challenge. And I know some of the practice here has been recognised nationally. It seems a long time ago now, but we have the number 10 task force come and have a look at what we've been doing in Northamptonshire, and I sat in on the feedback of that, and they were pretty impressed with the way Northamptonshire as a system had responded. We got all the angst out of the way in terms of the districts and boroughs and the county council, and we were working in a really constructive way, and I think that really helped add value to the COVID response. And then of course the health partners and the way it made us work better together. And again, that's another positive driver that we can really carry forward to help challenge and use as a catalyst for positive change. So the partnership is really solid, I think, and we've really got to use that to step forward. So the future, as I'm sure most colleagues know, we're going to have the West Northamptonshire Council, North Northamptonshire Council. We're going to have two health and wellbeing boards that I think will sit under the ICS board as well. So there is a sort of method into having two. And I know there's a couple of, I see Richard's on the call. Elected member colleagues were very keen where, have been quite pragmatic, I think, that where possible we have each West and North has its own train set, so to speak, that really defines and works with and for that quite defined population. And yes, there are the challenges of Northampton Town in the west and the deprivation of challenges in there. Also, Corby and some of the towns in the north. Equally, the rural areas and how we sort of bring all those together. So yeah. I think there's a huge opportunity. We've got a really great plan with the ICS system that I know has been signed off and approved. And to me, that we've just got to embrace everything we've worked together on and really run with that. And as an elected member, I love the fact that it joins right down into the roots of why I got involved in this business, if you like, and that's representing the communities and what we can do and use the value in community to add value to the bigger picture. So to me, that the whole ICS in a strategic view, but from the bottom up as well, is really exciting. And I really hope I'm involved as we move forward. As as an elected member, I've got to put myself up for election, and who knows what will happen in the future. But I think overall, our health and wellbeing board here, we've done a really good job. The partnership has been excellent. But also equally, we've got to challenge ourselves now to embrace the opportunity of this change and challenge ourselves within the health system and the new local authorities to keep pushing and driving for improvements. And where does the accountability lie in a lot of this? And often it's back with the health and wellbeing board, and we've got to really push and drive to make it work. And finally, I think we need to thank Nick as the chairman, the outgoing chairman. You stepped in again at a very pivotal point, I think, and you've been around for 3 years of the real most challenging times of you know, local government and the health with COVID and everything else. And you've done a really good job, Nick. So I really want to thank you on behalf of everybody here, and hope you can obviously stay around and be involved in the future. As the Health and Wellbeing Board it's a statutory board of the local authorities. I think the preference is to try and have an elected member as chair, but notwithstanding that, you know, we really value and thank you for everything you've done. You've been a great diplomat at times, I think, and you know, you've helped to drive and push us to where we are now. But I think the future, it's about us challenging ourselves as a partnership to be better, to provide better outcomes for the residents we all either represent or we work with, and you know, let's push on, use it as an opportunity for positive change. Thank you, Chair.
That's brilliant. Thank you, Matt. Thank you for those kind words as well. Any comments, Matt? We're going to hear from you a bit later on, aren't we, under item 9, future Northants updates. Just to echo those comments, I think, you know, it's about the future now. We've done our bit for the past, and I think there's everything to play for. So, and it's a great team that is assembled behind us as well. So thank you all. Right, updates then. So item 8, board updates. There are a few from me. Oliver Newbold joins the board. I'm not sure if Oliver's on the call right now. Joins the board, which is his first and probably last meeting as the full Northamptonshire board, as NH England representative, replacing Francis Shattuck. As I understand it, there has to be, or there should be, an NHSE representative on the 2 unitary boards. I think that's how it's going to work. Somebody will advise me if not. Anyway, Oliver, welcome. Tansy Harper has now left the board. We've known Tansy for a long time, resigning as chair of the NHCP Collaborative Stakeholder Forum. We've written to Tansy to thank her for the work that she's contributions to the board over the last couple of years. Lucy Whiteman, to bring a proposal for the Healthy Workplaces subgroup to be wound up, and for the People Board subgroup to take on elements from the Healthy Workplaces subgroup that do not already fall within this remit. Lucy, did you want to say something about that? It all sounds rather confusing, but I'm sure it makes sense.
Yes, thank you, Nick. So what we had ascertained was there were 2 groups who were, to all intents and purposes, covering very similar work. So there was duplication between the Health and Wellbeing Board, Healthy Workplaces subgroup, and then also the basically NHCP sort of People Board. So what Krishni Waring, who's chair of the Health and Wellbeing Board subgroup, had suggested was that the Health and Wellbeing Board subgroup was wound up, and that obviously a decision can be made if that work wants to continue under the auspices of the 2 new Health and Wellbeing Boards. But for the People Board at the NHCP level, to take on any elements of the Health and Wellbeing Board subgroups work that are not currently already in their remit, although there is a very, very large overlap, as we've already said. So that's the proposal. All of those people that Krishni liaised with, like Chris Oakes, who chairs the People Board, on behalf of the system, were supportive of that proposal. So that was the suggested way forward, really just to avoid that duplication.
Okay, thanks, Lucy. Makes sense. Any other updates from board members? This is your opportunity to share things that have happened. I'm sure things are happening all the time, but things you may wish to share with us. Searching for hands. Okay, well, that means that we can move on to item 9, which is future Northants update. Back to Matt, Councillor Golby. Matt.
Thank you, Nick. Okay, well, the D-Day is 1st of April, the beginning of the next civic financial year, which of course is next week, isn't it? So there's been a huge amount of work gone in, and the board has had updates all the way through this, from myself, Ian Vincent, David Oliver, you know, Chris Miller, when he was still around on the board. So there's a huge amount of work, and it's culminating in, you know, the drive to get over the line in a safe and legal way for the 1st of April. And it has been a huge task, not made, you know, made even more difficult with COVID. But again, there's been a real good dedicated team across the county council, the district and boroughs, officer and member level to make this thing work. And again, like I was talking about earlier, to drive better outcomes for our residents, basically, and that's what we're all here for. So there's a few points I'll just go through. So overall, the LGR programme is on track, and colleagues have been allocated to the North and West Northants, and there's some TUPE transfers on the 1st of April. There's a day one residents campaign that's already well underway with adverts on local radio, social media, public transports, and lorries like bin lorries, etc. All residents and businesses have received information on the new council with their business rates and council tax bills. The new websites have gone live, so you can also get feedback from residents ahead of the 1st of April. We're looking at membership for all the key forums and bodies, and we'll confirm attendees once that's agreed. Plans are in place for the elections on Thursday, the 6th of May. The count for the West, which will take place at Silverstone Circuit, and the North will be at the Kettering Conference Centre. The unitary count will take place on the Friday. There's the parish elections on the same day. That will take place on the Saturday. There's also the Police, Fire and Crime Commissioner count, and that'll be on the Monday, the 10th of May. We're continuing to work with health colleagues on the design and development of the ICS, which of course will be reported on at this meeting with DASs, and Stuart Lackenby is the DAS for the West, and I think his colleague from the North is here as well, and the chief execs. And also one thing that has frustrated us, of course, is the COVID issue, but there was a real energy and ambition to try and get as much transformation as we could into prior to going live on the 1st of April. And of course, a lot of that is having to have been put on hold and will continue as a programme well into the existence of the two new unitaries. But that's basically an outline of where we are, but it's exciting times. Maybe there's a bit of uncertainty around the system, but you know, everybody and all elected members have had an input into the system, and we want the very best for our residents that we represent, and that's why I'm here. I know Richard would say exactly the same, who's on the call as well, Ian as well. And you know, again, it's an opportunity to redefine what we are, what we provide our residents, and hopefully we can really maximise that and push on and provide really good two new unitary councils. And what Colin said earlier about the Children's Trust, you know, we've gone through the woes and wherefores of children's services, and that's been reported to the board as well. And the creation of the Children's Trust was a big moment. And again, I really truly hope that can really act as a new catalyst with the trust to improve those outcomes for our most vulnerable children. And yeah, so it's a big opportunity, and it begins next week. Thank you, Chair.
Yeah, next week. We've been talking about it for a long time. D-Day, as you say, is upon us. So good luck to everybody involved in that. Matthew, happy to take a comment or
of course,
clarifications? So colleagues, any questions for Councillor Golby on that? I'm sure you're all steeped in it. Yeah, it's been a lot of work. Joe, yes.
Having worked alongside many local authority colleagues throughout the COVID year that we've all spent, I just really wanted to commend everybody for all their hard work. Dealing with COVID alongside the formation of the unitaries has been an enormous task. We have some incredibly dedicated staff in our county. They are all working incredibly hard. They've managed shielded patient lists, things that were never within the remit of local authorities. It's been an absolute privilege to work with people. I really hope we retain the knowledge and the experience, and I know that there are lots of emotions despite the working hard and being committed to it. I know there are lots of emotions within people, and I would just urge us to make sure we don't lose the talent that we have. We really need to value that in our county, and just really my appreciation to everybody who's made this happen alongside the most difficult year that you could possibly imagine, and just to thank everybody that's involved.
Yeah, absolutely, Joe, and I will convey that message back through the teams, certainly at NCC. But the response has been absolutely magnificent, and yeah, and to to get everything done to where we are now, dealing with COVID, trying to recover the likes of the stuff at the county council, work with our district and borough colleagues to bring things to a better point. It's been absolutely huge. And I'll single out Teresa as well. Teresa Grant, Chief Exec of NCC, has done a magnificent job. And of course, so has everybody else. It's wrong perhaps to single out one single person, but the response has been absolutely magnificent. And I will make sure that those words are conveyed back. Thank you.
Thank you, Matt. Thank you, Joe. And Joe, that's summarised it perfectly. Very good. Thank you. Richard.
Yeah, thank you. Can you hear me?
Yes.
Yeah, it was just something that Matt said. I think he's articulated the narrative very well, but there's something he said that I think often we say that everybody's worked really hard and we've all come on a long journey and how wonderful it all is. And sometimes we deliver that because that's what is expected at this momentous moment. But in all reality, you know, there has been an incredible effort. I remember when I first came into politics, which wasn't that long ago, a little bit skeptical about the political class, but wanting to continue my public service. And to be fair, I've absolutely loved it, especially my constituency work. I feel like an old beat sergeant, you know, looking after my community. It's a wonderful feeling. But when I arrived on the scene, there was this animosity between the, particularly our feelings from the districts and the boroughs towards the county, all the shenanigans that were going on at the time. And then as we began to move into the unitary vision and the government pushing us into this direction, many of us were reluctant to do that, blame the county for all the woes and everything was disastrous. But did you know, over the years, through the leadership of people like Matt, who have been incredibly tolerant and taken an awful lot of stick and has been incredibly patient, there has bonds have grown, friendships and trust and confidence has grown to an extent whereby we have now had 3 really good years with NCC controlling their budgets, becoming a little more fit and healthier, and the boroughs and the districts working hand in hand to make sure this works, not for the political class, but for the people. So I want to say, I think this has been an incredible example of how hearts and minds can change when we actually focus on the people. And I think the leadership has been incredibly encouraging that actually we can do this. We don't have to be partisan. We don't have to kick chunks out of each other politically. What we can do is when we work together, we are incredibly effective and we can do great things. I hope for the future that continues, you know, between the North and the West. I really do. But more importantly, what I hope is that we understand that we have to all work together intimately. None of this, you know, this is my silo, this is my budget, I can't really spend on that because it's not my remit. The old slopey shoulders, we used to call it in the police, you know, it's not my responsibility, it's somebody else. That we collaborate together more effectively to ensure that the people get the service. It's not their fault that we're having an argument over who should pay for what. So we need to be more pragmatic, more focused on the individual and work together closer. And if we can do that, I think we will have a very, very bright future. Thank you, Chair.
Very well said. Thank you, Richard. Other comments from colleagues? If Richard, is that a legacy hand up there, or is it another one? It's a legacy. All right, thank you so much. Then let's move on. We're still in the update section. So item 10 is the Better Care Fund and the IBCF and the Icam workstream updates. Just to remind us that the board here has a statutory duty to scrutinise performance of these plans and work streams. So can I ask Sam Fitzgerald to introduce the BCF and IBCF quarterly update?
Good morning. Thank you, Chair. Okay, so I'm going to give you just a brief overview of the 4 key performance indicators for Q3. These are geared towards the improvement of the urgent care flow. So starting with the reduction of non-elective admissions to hospital, in this performance indicator, we're seeing a positive trend with non-elective admissions. We've seen a 22% reduction on the same quarter last year, which is really positive. In relation to delayed transfers of care, again, there is no update. There was a pause in the reporting and recording of this metric due to the COVID pandemic. Moving through to the rate of permanent admissions to residential care. Looking at this, that we can see that this is significantly lower than has been recorded in previous years. We could say that this is likely to be as a result of the COVID pandemic, but obviously there was the national discharge guidance and a move towards discharge to assess with trying to get more people home. So that's a really positive trend on that performance metric. And then moving through to looking at the proportion of people over the age of 65 who are still at home 91 days after discharge from hospital into reablement or rehabilitation. Again, this metric showing a really positive trend at the moment and an increase on last quarter. Again, we have, listened to the national discharge guidance. We've been working through the new ways of working, and we've seen significant increases in the amount of people that are going through reablement, so people going home. And again, that's demonstrated by the reduction in people who are going into residential care. So again, that's a really positive metric. I'll pause there in case there's any questions.
Thank you. Any questions for Sam? Can't see any hands. Okay, Sam, carry on.
That's my update. It's a brief update, but concise.
Okay, thank you. Very brief, very concise. Just what we like. Thank you. So Ruth Harrison. Ruth, can you update us on the Icam programme, please?
I can, yes. Thanks very much for asking me to give a brief update on the Icam programme. Charles kindly said that she'll circulate these slides, so I'll just concentrate on a few key issues and areas, if that's okay. Move on to the next slide. We're moving into the next phase of Icam, which is the design and implementation phase. So we're looking for some external support on that, which is taking up a lot of our time at the moment. But in the meantime, we're certainly not pausing with our three pillars, which are community resilience, flow and grip, and frailty escalation and front door. And the next slide, if we can go to that, highlights some of their progress. There's a lot of detail here, so as I say, I won't go through it all. I'll let you read that later, but just a few examples. In community resilience, progress is being made in all the primary care networks towards them having frailty clinics and recording the information about their frail patients, so that if they need access to other services, we don't have to start again every time they hit a new organisation. And that's, so just one example, if a patient comes into hospital, a frail patient, it reduces the time, this will reduce the time taken for a geriatric assessment from around 2 hours 45 minutes to around 10 to 15 minutes. Now, you can imagine that makes most enormous difference for obviously the staff, but also the patients who don't have to go through delivering all their information again every time they meet someone new. In frailty escalation and front door, we're halfway through a pilot where EMAS can call one number, which will notify the frailty units if they're bringing in a patient who's likely to need their care. Yesterday, we reviewed 2 case studies of patients where this enabled the patients to be discharged on the same day, having been assessed, treated, and the support provided without needing to be admitted. So that's really sort of storming ahead there. And in flow and grip, again, just one example of the projects. And we're looking at improving communications with patients who have to be admitted to hospital. The project has reviewed all the comments made by patients over what had been a very difficult last few months. And they're now incorporating these into revised pathways, training and communications. So I've said there's just a few examples of the enormous amount of work going on right across the system. And I'm delighted that we now have patients and carers involved in many of our bricks, and the level of enthusiasm from them and the staff from every organisation, it's incredible, and it's deeply inspirational. So I'm happy to take questions and any comments.
That's great. Thank you, Ruth. Yes, Joe.
So it's really in support of Ruth, just to say how much work is going on, and really just to notice some of the themes of the areas that are dominant at the moment is about enhanced communication, sharing of information, and there's going to be so much more that we'll need to build on those foundations. So if you look across her slide, there is a very strong emphasis on that. And actually, without that, we will struggle as a system. So I think as we've all spent the last year learning new ways to communicate and share information, I think that's going to be absolutely key moving forwards. And there is a huge amount of activity. There are huge opportunities. And I would also like to remark that the opportunity of, do you really want to be in hospital? We have an opportunity with our population where hospitals are regarded in a different way. Rightly or wrongly, we're all reevaluating, when do we need to be in hospital? When do we not need to be in hospital? And so I think this is actually, strangely, a really good time to be doing this. And I think patients really appreciate not having to tell their story more. It's going to make a massive difference.
Yeah, thank you, Jo. Naomi, and then Ali.
Thank you, Chair. I mean, it's a sort of comment question similar to the question that I asked Colin. So I was thinking as you were presenting, it was really good. Shall I put you on the spot in terms of, do we have a similar thing to an older people's panel that you got a children, young people's panel? And then I heard you say, well, we go through all the comments made and incorporate them in, which is really great. That's a good use. It means that you're using them. Again, was there any comments that surprised you, or you thought, gee, we never thought of that, or we never thought that might be something that, it's about how do you get into the head of that side of the service rather than the delivery side of the service? So, and the examples really bring these things to life for us. So are there any?
Yes, certainly. One that has very firmly stuck in my mind is that one of the patients, we were trying to get a patient home, and the staff were sort of layering on the support to enable the patient to go home. And the patient said, I felt I had to accept the support to enable me to actually get home. And they went home, and of course they then cancelled most of it because they didn't really want it. It was almost this, I need to escape from my hospital bed, and the only way I can get out is by saying yes to everything. And they didn't really need it. So, it was one of those ones that was just very different from what we were expecting.
And it leads you to ask the question in a different way. Yes. That's the important thing. If I may, Chair, I had a wonderful example years ago from children and young carers. And I was running a charity, we were liaising with the schools on explaining why the children might be late for school because of the care they had to do for their parent before getting to school. What the kids wanted was taxi fares. They did different from everybody else. They wanted a way to get to school on time. And those little examples, I just think they're really priceless.
Yep.
And we did give them taxi
fares. Alison.
Thank you, Nick. Just a brief comment from me. It's just a reminder to the board that we have that the Icam programme is one of 4 priority programmes. So there is the elective care, the mental health, and the children and young people transformation work, which are all accelerating at different paces. And the children and young people's work encompasses and links with what Colin was describing earlier on. So it was just for clarity, there are 4 priorities. Thank you very much.
Thank you. Any other comments for Ruth? If not, we can thank Ruth and Samantha for those updates. And on the theme of integrated care system plans, item 11 is a report from Naomi. Can I hand over to you, please, Naomi?
Well, thank you very much. It's going to be a double act for me and from Toby, but I'll kick it off. Apologies for those people in the room who have heard all this, but I think it's really important for everybody to hear the same message at the same time. So you might be bored, but you might not have heard it. The ICS, as you know, the Department of Health and Social Care published a paper in February that is moving towards making ICS statutory as of April 2022. What the paper says, what the white paper says that the purpose, or the triple aim of integrated care systems are to improve health for all, improving health services for all. And I think that distinction between improving health and health services is very important, because we know that the vast majority of drivers of ill health have nothing to do with health services, have everything to do with what the Health and Wellbeing Board is all about, and sustainable use of NHS resources. I have to say, I prefer the 4 aims that are in the NHS England and Improvement paper that sits alongside the white paper. So in addition to improving health, the NHS England paper talks right throughout about reducing health inequalities, sustainable use of resources, but also, again, an aim that's very, very lined up with what the health and well-being boards do, which is contributing to the economic and social well-being of the population. And what that's about is that the NHS and indeed local government are massive employers. They manage huge estates. They manage land on behalf of the county. So they have a role to play in making sure living wage. They have a role to play in making sure good employment. They have a role to play in liaising with Nick's organization in training and development of young people so that they can work in these big organizations. As employers, they have a role to play in saying what their training needs are for the future. So that contributing to the economic and social well-being of the population, I think, is really, really important in terms of what ICSs are all about. How will ICS do it? By, giving huge amounts of work to poor old Lucy's team, because a lot of what we do has to be based on public health data. It has to be based on what do we know are the needs of our communities, and then are there ways to meet those needs that aren't necessarily health services, but health services are clearly part of it. Social care services are clearly part of it. The white paper talks about a two organization integrated care system. So there's an NHS statutory body to be created, which will develop a plan to meet the health needs of the population, develop a capital plan, secure the provision of health services, and delegate to place level. And by place, in our case, we're meaning the two new unitary authorities, and to provide a collaboratives, so that a lot of decision making on exactly what's happened will be based at place level, not at ICS level. Alongside that will be an ICS health and care partnership, which will develop a plan to address the needs of health and care needs of the system. And that plan will inform the decision making both of local government and of the NHS statutory body. Now, there are some big challenges in all of that. Toby's going to go into the detail of what we're doing, how we're getting going on these challenges. But for me, I think one of the big outstanding challenges is that the Secretary of State is very, very keen on coterminosity with the local government footprint. And that does present some problems for us in the sense that that Joe pointed out to me quite rightly, of course, is that is the coterminosity where people live or where the GP practices are located, because of course many GP practices around the edges will have people who don't live in either of the local authorities. So there's a big issue about population planning and also, of course, funding of local services. There's a big issue, I think, about the role of elected members, in the sense of health and well-being boards are chaired by elected members, and local government, in the way it operates very differently in its governance structures from the way the NHS operates. And then there's a big, well, I wouldn't call it an issue, just an absolute essential, but not sufficient, but essential is that the ICS will take on the role of the CCG, but until that happens, we have a very high-performing CCG that has to continue its core tasks during the transition. So similar to what Northamptonshire as a county has gone through in the last year, moving from a county to two unitaries, we will be moving from a CCG to the ICS, but at the same time, we have the statutory duties to continue. So I'll hand over to Toby, who will tell us exactly how we're going to solve all those challenges.
Thanks, Naomi, for setting me up there with a nice straightforward task. Good morning, everyone. Good to be with you. Apologies for my tech issues earlier on, Nick. I think I'm sorted, fingers crossed. So hopefully I shan't drop out during this next little update. Just building on what Naomi's outlined, wanted to say a little bit about the approach that we're taking across the Health and Care Partnership locally in terms of how do we respond. So that I think the opportunities here, because for me, in many respects, you look at it and think coming out the back end of a pandemic and we're starting to ease into getting back to some other areas, a significant change, restructure, reorganisation, reform to parts of the NHS and wider care system, on one level looks like the last thing we could all do with. But actually, I think most of us locally, and building on what Matt Golby was sharing earlier on, what we've seen in the last 12 months has kind of been the best example for me of a system working together as a group of partners in the way that is best for the local population, and much less focus on individual organisations than we could ever have kind of imagined in any other situation. So out of that really kind of very challenging, tragic set of circumstances in many respects, we have seen that real kind of positive coming through about how organisations have worked together. And in large part, I think that's why NHS England nationally and the government has decided actually now is precisely the right sort of moment to be making those sorts of steps to capitalise on that, to not go back to some of the organisational focused siloed arrangements and the kind of joins between different parts of our organisations, and to really take a bigger step forwards. The other reason I think for me why now is absolutely the right moment for Northamptonshire, not just from a national perspective, is of course because the moment around the creation of the 2 new unitaries, and also where we are in terms of some other parts of our arrangement. So general practice working together in their primary care networks have really stepped up amazingly over the last year, and in particular over the last 6 months in their big role in the vaccination programme. And it's, in a sense, it's almost been their first big real task, and you kind of couldn't have given them a bigger, more mission critical one to get stuck into, but they've really come together through that. And so we've got the unitary creation moment in Northamptonshire next week. We've got primary care networks working together. We've got an acute group model that's really starting to find its feet, with the 2 acute hospitals working together very, very jointly. We've got NHFT working in collaborative arrangements around mental health services across these Midlands. So lots of bits of the jigsaw that are all leaning in the same direction, which is how do we collaborate more and move away from that kind of competitive commissioner-provider split we've had probably for too long over the last decade or more within the NHS, and move to something that is much more about system working and approach. So for me, the time for all those reasons nationally and locally is right. In terms of our approach to all of this, had a really constructive session last Thursday, and I'm conscious many people on this call were at the Health and Care Partnership Board meeting last week, where we went in some detail through how do we kind of chunk down the next 12 months into a series of phases, and these are set out within the paper in front of us today. And just to briefly walk through those, the first phase in this, in terms of what was signed off last week by the Partnership Board as a broad approach, is something we've described as a system ambition and shape phase, which I appreciate could sound a bit conceptual and woolly, but given all the moving parts I've just described, this is really important in Northamptonshire that we do this phase and we do it well. There is too much of a risk here that we just kind of lift and shift some of our current arrangements into a new set of statutory organisations and kind of trundle along as we were before. And I think all of us involved in this in our various roles, for the reasons I've just described, as well as the population health challenges for our population and patients, have said we'd be missing a massive, probably once in a generation opportunity, certainly once in a career opportunity, to do something really different for the county. So we want to spend pretty much Q1, April, May, June, having a big partnership conversation with some external support to make sure we've got some good, objective, independent facilitation into this, to say, before we actually start running into implementation and setting things up, let's just take a moment and just reflect on the things that we really need to put in place as part of this. And there's some big design choices for us in all of this. Naomi's alluded to some of them, but just to add a little bit to that list, where do we want to be on the kind of health and care integration agenda? You know, how much do we want the NHS and local government to really pool resources, pool funding, jointly commission, provide locally at place in a joint way? How do we want to build on our place geographies, both the unitary footprints, but also what we might do at locality level, and also what we might devolve into primary care network level? And how does the role of those 2 new health and wellbeing boards connect into this? I know Naomi and I and many others are really quite interested to explore how far the 2 new health and wellbeing boards could also take on the role of that statutory health and care partnership function in those 2 places. Because I think, frankly, the last thing we probably need in this county is adding more layers into our governance. And I can see Nick smiling at that one. We could do with kind of thinning and streamlining some of this. So there's some big design choices in this, as well as to what extent do we want to devolve and delegate resources, both people and funding, into some of our provider collaboratives, whether they're the things that we've just been hearing about from Ruth in terms of Icam and integrated care, whether it's the work we do on mental health, and so on. So some really big design choices, and if we don't settle on some of those things through a collective conscious discussion in the first quarter, we're going to struggle to be able to do what we need to in the timeline that we have over the remaining 3 quarters to get to April of next year. And the paper then sets out effectively a phase 2 exercise here in the second quarter that'll be much more about getting into the detail, and our local government colleagues know this only too well from their experience of the last couple of years, around how do we get functional and resource mapping into the right parts of the system to support that transition as we go through to April 2022. But just to be clear, at the moment, our expectation is legislation and a bill being put before Parliament some point in the late spring, early summer, that would then enable us to move into a fuller shadow and implementation set of planning as we go through the year to create that new body, but almost more importantly, to create the different arrangements at different levels of place and for our priority areas. And the final thing I will say, Nick, before pausing for breath and handing back to Naomi, is in the midst of all of that, we've got to make sure that we don't take our eye off the ball of actually what we're here to do, which is not to rearrange organisations and do structural change, but is to deliver on the big priority areas that we've already set as a county. And so I think it's really helpful that Ali reminded us again earlier on of those big 4 priorities that we've latched onto. Of course, the children's and young people, links into Colin's item earlier, the Icam work, big focus on elective restoration, improving services, digital agenda within all of that, as well as the mental health agenda, more important than ever coming out of COVID in terms of the impact on mental health, both from a COVID and non-COVID perspective. So I think Naomi and I are very focused on how do we do all of this transition piece, but also keep absolutely the eye on the ball with delivering on those areas as we go through the year. I shall pause there, hand back to Naomi for part C of the paper before I think, Nick, we get kind of into questions and comments. Thank you.
Thanks very much, Toby. Just to say that the most contentious bit of the board meeting last week was membership, as the interim membership of the new ICS board. I won't go into all the gory detail, but I will say in terms of that it was very important for me and for Toby. I mean, my background it's much more linked to local government than it is to the NHS. And it was immediately obvious to me when I joined as chair of the ICS back in October, that we were incredibly overloaded in terms of NHS and we're not balanced in terms of local government representation, and that we felt that we had to address that balance. And where we were overloaded and what was very contentious was the amount of GP representation, not necessarily GPs, but representation of bodies. And what I came to understand rather quickly and rather surprisingly, again, my question to others about, well, what surprised you? What surprised me most was I thought that my job was to chair a body that was about integration between local government and the NHS. But in fact, it was largely about integration within the NHS itself, because of what Toby describes as the purchaser provider split, integration within CCGs, GPs, acute and community. And of course, community services always get left out of the argument. These important things like how does dentistry work? How does optometry work? How, all these things that we rely on all the time need linkages that are very difficult, and I certainly don't wholly understand yet. So what we wanted to do was increase the representation of local government, not have too big a board, and it's still way too big, it's still around 30. But the other thing was to understand some sort of equivalence between what in the NHS is clinical leadership and is in local government professional leadership, which was why we thought it was important to have the directors of adult services there, the director of children's services there, alongside the clinical leads for the GPs or for the acutes, because that's where the technical expertise of, it's one thing to ask the people who use the services what they want. It's another thing to check that the people who understand what the science tells us actually works is what we deliver. And that's where I think clinical leadership is incredibly important in what we do. So we did rebalance it. And as Toby says, going forward, at the end, the final NHS body is likely to be much smaller and much tighter, but we are hoping that we can come to some agreement about how the functions of the health and care partnership are sort of integrated in with health and well-being boards. And just to pick up something that Matt said earlier, certainly the LGA is campaigning very hard for the Health and Wellbeing Board to be the upper tier and the ICS to respond to it. So those decisions aren't yet made, and there are big arguments to be had. And hopefully they're not going to be arguments. Hopefully they're going to be, as Toby says, so how do we organize this in the best way to get the best outcomes for the people that we're serving? And finally, I will say there are going to be real small political difficulties as we go forward, because if we really want to reduce health inequalities, it means moving resource to the poorest areas, which means moving resource from some of the wealthy areas. And I've already had a couple of chats with MPs about this. And of course, some of them, because of their own constituents, aren't terribly happy about that. So those issues about really checking each time, why are we doing it? How will it improve things for the population? And can we afford it? In my view, are the key questions. Thank you very much.
Thank you, Naomi. Thank you, Toby. Any questions? Point well made, Naomi, that I guess others have heard this, and others may not. So you've got a bimodal audience. Fascinating for me. So the board are asked to do some things, and I'll just go through it so it's all covered off. So to note, the white paper proposes to establish statutory integrated care systems, which will be made up in part of ICS, NHS body, etc. That's part A. So we've noted that. Thank you. Note the establishment of a transition programme in the overall context of refreshed ICS development plan. That's part B. Note the short-term proposal to change the board from the 1st of April 2021. Glossed over. Love. I'm sure that was a fun meeting. And to support the opportunity to take forward further work to consider additional changes to the NHCP board membership and support of Part C. The transition to a shadow and then full ICS board and NHCP functional alignment with the evolving local health and wellbeing boards, the two that will be set up from April the 1st. So I think we're all content to note and approve all of those if we need approval. Thank you. Thank you, Naomi. Thank you, Toby. Unless there's any other comments on that, we can move on to item 12, which is a strategic item, the KGH HIP2 programme. And I'd like to invite Polly to present a verbal update on the redevelopment work taking place at Kettering. Polly.
Nick, Polly hasn't joined the meeting yet, so did you want to move on to the next item, Lucy's update?
Blimey, they finished it already, have they? Okay. Sorry, flippant last meeting. Item 12 is PhD programme. Lucy, can you provide an update on the Wellcome Foundation PhD programme, which actually works with the University of Northampton? So I do have an interest here. Lucy.
Of course, and it does indeed, Nick. So again, NHCP board members will be aware of this proposal, but the university and NHCP obviously are hoping that we have the Health and Wellbeing Board support as well. But I was recently contacted by one of the professors at the University of Northampton. There is a nationally funded programme through the Wellcome Trust, which I'm sure lots of our members are familiar with regard to 3 to 5 fully funded 3-year full-time PhD studentships for health professionals. So what the university want to do is put in a bid to host and provide those PhD studentships for local health and care professionals. And what the Wellcome Trust do obviously is provide the investment for the university to cover the fees, but it actually also provides the full salary for the member of staff that obviously we would look to be coming from local health and social care organisations to undertake that full 3-year programme of study. What we're keen to do, and with the board's support that Naomi's already expressed in one of the previous boards, is look to answer some of the health and social care questions that are really local and really ingrained by using these studentships if we're successful in our bid. So it's really just asking for the Health and Wellbeing Board support and making sure they're aware of the fact that this bid has gone in with support from NHCP board on behalf of the University of Northampton, and obviously recognise the potential opportunity, should we be awarded this, to get our staff upskilled and give them an opportunity for a fully funded PhD, which I'm sure you'll appreciate would be a superb opportunity, not just for them as individuals, but also to get some of those really tough questions asked through that research being done at a really local level.
Thank you, Lucy. Just for the record, I won't make any recommendation for or against this because I am, it's a disclaimer piece, but I'll offer comments for others to support or not. Toby, yes.
Yeah, hi Nick. I'm very supportive of this. It's something Lucy and I have discussed on a number of occasions recently in different places. I think we have a real opportunity locally to build on the strengths in terms of our research and academic base, and to use that in terms of informing practice and service developments as we go forward. So I think this is something that I'm very supportive of. I would imagine many other colleagues, I know a number of our NHS colleagues can't be here today because of clashes with board meetings and so on, but I think this is a good development, something that fully has my backing, and I know others across the partnership. Thanks, Nick.
Okay, thank you, Matt. That's great. So unless there are any other comments, we can note that there is approval from the board, and we can move on to the COVID-19 updates. Refreshed local update, outbreak plan, testing and mass vaccination. I think it's a combination of Lucy, Toby, and perhaps Ian Morris as well. But Lucy, can I hand over to you first, please?
Yeah, absolutely. Thank you, Chair. So a very quick update. Northamptonshire obviously continues to be quite a challenging area with regard to a huge variation of COVID rates and positivity across the county. In fact, it was one of my consultants that made the comment to a PHE regional team member that actually you've almost got that the variation that you see across the whole of England sort of encompassed in Northamptonshire. And it's very, very true. And obviously that's what makes our job as a system so very challenging with regard to making sure that we respond. Just so people are aware, we've got Corby with one of the highest rates still in the country. It's at this point in time the second highest rate in the country at 182.8 cases per 100,000 as a rolling 7-day average. That varies all the way down to South Northamptonshire with just 26.5 cases per 100,000. So Corby being statistically significantly higher than the England and the East Midlands rate, which, by the way, the East Midlands has a statistically significantly higher rate than the country. So the East Midlands, in fact, the Midlands generally has struggled very much throughout this pandemic. And then we've got obviously places like South Northampton, Daventry, Wellingborough, which have got statistically significantly lower rates than the England average. So it's a very, very challenging picture. We do have, though, reducing positivity in Corby, which is good. So we're hoping to see the follow-on to that, which is usually a slight reduction in the case rate. But we do know that the over 60s cases have gone up in Corby recently, although we are seeing some progress in the younger age groups. The school return has been broadly successful, and I thank again everybody at the County Council for their support in the school cell, but also all of the teachers, support staff and pupils and parents for engaging so positively in the return to school programme. We do know and do recognise that quite often guidance and requirements come quite late in the day, and all of our schools have stepped up to provide very robust, very organised testing regimes for their staff and their pupils. And indeed, we've got reports of schools with, more than 60% of their pupils and staff engaging in that, which actually for a programme that was introduced at very short notice is a real success. We also have a number of testing facilities in the county. So just find the right set of slides, because this is, again, changing very rapidly. People will know that we've got a local test and trace partnership with the national programme. So we've had that in place since the 15th of August last year. That at the moment is managing to follow up 90% of all of the cases between the two sort of sets of follow-up organisations. That for me has stagnated a little. So we've actually in the last week started to look at how we can start to try and reach out to that last 10%. Clearly people at this point in time are not legally obliged to disclose their contacts when they are identified as a case. So obviously we have to make sure that we've got as many different ways of encouraging people to disclose so that we can help protect the people that they may have been in contact with and potentially infected with COVID-19. The team itself, though, locally follows up around 98% of the cases that get referred to them. So they do have a very good success rate locally. And we currently are the second highest follow-up between the partnership in the East Midlands. So it is a good news story for Northamptonshire, but we recognise there is obviously more we want to do to reach out to those last few. Just so people are aware, we obviously still have a number of different testing sites. And again, I want to take this opportunity for people who are symptomatic to be accessing the PCR testing sites. And we remain with a regional testing site at Kettering Conference Centre, but we also still have those local testing sites in Corby, Daventry, East Northants, Kettering, Wellingborough, Northampton and South Northants. And we have mobile testing units that go round and we direct in areas of high prevalence or where we have outbreaks. We currently have 4 mobile testing units in the county, in Corby, East Northants, Northampton and South Northants. We're trying to make sure that we cover as much of our rural geography as well. The more important news is that we've progressed the asymptomatic testing site. So this is lateral flow rapid testing. This is for people who do not get tested through their current place of work, but who are having to obviously return to work because they're either key workers, because they are part of a childcare support bubble perhaps and can't obviously access tests through school, or again, indeed, are needing to provide care, etc., for people within support bubbles. So this is a rapid test, not as sensitive as the other test. People must always, if they have a negative test from a rapid flow test, still abide with all the rules, keeping your distance, wearing your face mask, washing your hands frequently. But we do now have 6 lateral flow testing centres, 2 in Corby, 1 in Northampton, 1 in South Northants, 1 in Wellingborough and 1 in Daventry. And the scoping is already in progress for a lateral flow testing site in East Northants and Kettering. They do have capacity, so please do obviously take that opportunity if you are, particularly with the relaxation of rules further next week, if you're out and about, you're seeing people, do recognise you still potentially pose a risk to the people that you meet. As exciting as it is to start seeing them, please do access these testing sites and please do stick to the hands, face and space rule.
That's great, thank you, Lucy. Any other comments? Toby, did you want to add anything, or Councillor Morris?
Nick, I thought it might be helpful just to provide a quick update of where we are from a vaccination programme perspective, if that's of interest to colleagues. I shall keep it brief. But just in terms of kind of headline position across the county, continue to make really good progress in terms of rollout of vaccination programme. In fact, as of yesterday, we've hit another milestone, a positive milestone across the county in this, which is that we have delivered our 300,000th jab in terms of vaccinating people. So as of close of play last night, our latest data is running at 300,099 people have received their first dose across the county, and a further 24,000 people have received their second jab as well in addition to that so far. And that continues to be delivered through a range of different sites. We've got 16 primary care network sites delivering local vaccination services through largely GP run sites. And actually the vast majority by volume of our jabs have been delivered through that route, 235,000 of those. The vaccination centre, the large vaccination centre, which is running at Moulton Park here in Northampton, literally out of my window as I'm sat here at the moment, has already delivered 64,000 vaccines through that site since the programme started. And our hospital hubs as well at Kettering and Northampton, 25,000 or so delivered through there, and starting to get back into second doses for those people who are approaching their 12-week mark now as well. In terms of progress through the initial priority cohorts, so the kind of cohorts 1 to 9, which is all of the over 50s, as well as our workforce, care homes, clinically vulnerable and so on, continuing to make really good progress through those areas, with most of those cohort groups north of kind of mid 80s to sort of mid 90s percentages, very slightly in terms of different age groups. Big focus at the moment on reaching out to those remaining people within those cohort groups, because when you look at averages, you know, if I take something like the 70 to 74-year-olds, we vaccinated 94% of them across the county. That still means that the 6% of people, according to our data, out there who we would like to be able to reach out to and make that offer to. Clearly, it's a personal choice, but we would absolutely encourage, as would all of our clinical teams and colleagues, would encourage members of the public to take up that offer and to come forward. So focus at the moment on reaching out to those remaining folk within those priority cohorts 1 to 9, and in particular trying to look at the inequalities agenda, which we know is impacted on uptake levels in some of those priority groups. And that's not just a BAME issue in terms of ethnicity, but also in terms of geography, deprivation, and actually some of the kind of cultural differences in terms of language and different communities that we have within our county. And Lucy's team, from a public health perspective, are doing some really detailed work at the moment, looking at different levels of uptake across the vaccination programme to make sure that we can target specific support and messages, and in some cases pop-up services into different communities to do everything we can to reach out to those people in those initial priority cohorts. We are now moving into kind of detailed planning for phase 2, if I describe it as this, which is going to be the kind of 50s and downwards, or 49-year-olds and downwards. We will see some changes across the county, some small changes to some of the sites that are delivering services in that, particularly some of our GP-led sites who all along this have been trying to balance their day-to-day work with the pressure of delivering an enormous vaccination rollout programme. So some of them may drop out of delivery sites going forward, and we're just making sure we've got the right coverage across. Of course, people will recall the kind of national coverage, particularly in the last couple of weeks, about vaccine supply. That is impacting on Northamptonshire in the same way as the rest of the country. And so from next week, we expect to go, and we will go into a number of weeks where we have significantly more constrained supply coming into the county. That won't affect the second vaccination doses, which are a protected ring-fenced allocation that comes through to us, but it will see a significant drop-off in the number of first dose vaccines that we're able to deliver, certainly through the first few weeks of April, and I suspect probably continuing a little bit beyond that. But just to say, as we're sat here today, programme continues to roll out really well. And in terms of just giving an insight into that, the centre opposite me at Moulton Park out the window has been busy all day. We're still delivering over 1,600 vaccines per day through that site, and that's going to carry on through the next few days. So yes, we're going to go into a slower April on first doses, but we're still making really good headway at the moment. And a big thanks for me to all of the teams who've just pulled out the stops over the last few months on this, because it's just been a staggering effort. And to think, Nick, that at the end of the kind of last meeting of this Health and Wellbeing Board, that literally if we were to look back to this meeting 6 months ago and said that we thought we might have vaccinated 300,000 people across the county, I think we'd all have been, a degree of kind of, the ambition there would have been great, but I think we might have questioned whether it was doable, and our teams have pulled that out of the bag. So we should be really proud of them and grateful. Thank you. Happy to take any questions.
Yeah, here. Thank you, Toby. And absolutely echo all of that. I've got Lucy and then Naomi.
Apologies, I also should have mentioned that we're updating our local outbreak management plan. It is a requirement after the publication of the roadmap out of lockdown for us to refresh the plan that we originally developed in June last year. The draft went to the SCG board last week for comments. It has also been back to our regional convener and Public Health England for comments, and it also went to the Oversight and Engagement Audit draft. So we'll be taking back all of the feedback, developing the areas that we've had any recommendations to improve, and then we will circulate that. As it was previously, though, it will be an iterative document because obviously guidance changes so frequently. It is quite high level and strategic for that reason. But we'll make sure that obviously that's updated and circulated as that gets signed off. So just to make sure that people are aware of those, the need for that to be updated to reflect the roadmap.
That's great. Thank you, Lucy. Naomi, did you have a comment?
Mine was a clap, not a raised hand.
Absolutely. Well clapped, madam. Well clapped. Are we through this item? Ian, did you want to say anything?
No, not really. I mean, just to echo everyone else's praises for the teams, and to say I went to Moulton Park on Tuesday for my first jab, and it was such an efficient machine, but in a good way, because everyone was still very nice with all the procedures and everything. It was a really positive experience, and I thoroughly recommend it to anyone that hasn't yet had the jab. That's all I would add. And to say how marvellous it is seeing all the systems working together across the whole county to make this happen. It really is an amazing team effort. Thank you.
That's great. Thank you, Ian. And apparently it's being rolled out to the under 40s next week, so I'm looking forward to having mine.
I'm delighted that we've been building vaccine confidence. I think that's been a really important part of what we've been doing, appreciating that we are not yet vaccinating all adults, and appreciating that in particular general practice is experiencing significant pressure from politicians and from our public to bend the rules. We are really sympathetic. We're delighted that people want the vaccine. We will get it to people as quickly as we can possibly manage. But MP letters asking for exceptions, it is really difficult, and we need to be equitable with the offers that we give to the population. We are going to follow national guidance in Northamptonshire. We know it's difficult, and just for any members of the public who are dialed in, we will get to you as soon as we can, but your MP is not going to make a difference to that, and really our MPs have lots of other really useful things to be doing. So completely appreciate people's desperation. I take it as a mark of increased vaccine confidence, and really happy to help people make their minds up so that when they're called, they can make that decision without hesitation. So thank you to everybody who's helped to build that.
That's very helpful. I mean, on that vaccine hesitancy, without wanting to prolong it, do we have any, are there any stats on whether people are actively rejecting vaccines in the age groups? I mean, is it, or are we getting sort of 95, 98%, whatever it is, people through the system?
So I'll take that if you like, Nick. We don't have stats on kind of the specific, sort of vaccine hesitancy point. Anecdotally, I know a number of our teams have reported, quite understandably, particularly over the last couple of weeks with some of the European kind of speculation about, particularly the AstraZeneca vaccine, that perhaps some people have been spending a little bit longer just making up their mind and thinking it through. And some of our teams delivering vaccines have said they spent a little bit more time in conversation with members of the public who've been coming forward in terms of reassuring them. But if you look at the kind of crude numbers in terms of where we are, the overall percentage numbers across those cohorts, it doesn't appear, thankfully, at this point in time to be impacting in a big way. And I'd just say long may it continue in that vein. I suspect as we start to go down the age cohorts, we would probably expect to see some of those more people not choosing to take up that offer. But we really would encourage people, when you get invited, and I'd emphasise Joe's when, rather than trying to come forward until we get to that point. I, like you, Nick, am looking forward to the sub-40s as well. Sorry, sub-50s coming through. But I suspect we'll get there over the coming weeks. So please do wait your turn, but we will get to people. And when we do, please do come forward. Thank you.
Well, funny enough, Toby, we had a meeting with Chris Whitty, a couple of us about a week ago, and off the record was saying that they do expect to see more resistance amongst younger age groups to the vaccine, which I think is odd, but we'll see how that pans out. Do we have Polly? Is she back in for item 12?
No, Polly hasn't joined yet, so.
Okay, so let's move on to 15 then, item 15, which is, again, back to Lucy, Northamptonshire Joint Health and Wellbeing Strategy. It needs a refresh, Lucy, so I understand.
It does indeed, Nick. So people will remember that in 2015, so pre my tenure as a DPH, a Health and Wellbeing Board strategy was developed by the then DPH and portfolio holder and chair of the Health and Wellbeing Board. It was long term and absolutely met and highlighted, didn't meet necessarily, but highlighted all of the needs in Northamptonshire and provided a structure, obviously, for the Health and Wellbeing Board work going forward. We've been working to it for the last 5 years. It expires at the end of 2020, 2021. The challenge, obviously, has been that until we obviously have our new chairs in place, it's not been appropriate to design that new Health and Wellbeing Board strategy. We have all of the data that will be required to do so, but there still needs to be a discussion post-elections as to how we wish to proceed. So it's just really making sure that people are aware that although that strategy has expired, the content of it is still very much appropriate. We had actually incorporated a refresh into our system long-term plan, but sadly we haven't been permitted to publish that. So I don't want people to think we hadn't done anything in preparation. It's just that we haven't been able to publish it. So at this point in time, until we get our new portfolio holders in place, it's a request to continue to work to the current strategy and obviously take the opportunity with the new portfolio holders to identify how that strategy should be shaped with the boards and to obviously provide a new either single or two separate Health and Wellbeing Board strategies post-elections.
Okay, thanks, Lucy. I think that makes sense. Unless there are any comments from colleagues on that, we can move to item 16. So back in September, actually, Adam Smith highlighted the lack of approved mental health professional provision in the county and the risks that might pose to health to patients. So can I invite Adam, please, to update us on progress?
Sam's going to give a quick update because Adam can't be.
Okay, sorry. Okay, Sam, thank you. Over to you.
Good morning. I hope I'll do Adam's report justice. Unfortunately, he's been delayed because he's tied up with Mental Health Act assessment and can't make today's board. So it was raised at the Crisis Concordat that there were some concerns in relation to the volume of approved mental health professionals within Northamptonshire and potential impacts that they might have on mental health assessments. We broke that down into a couple of component parts. So what I'll do is just run through the key topics. So one of the main areas of focus was around training for approved mental health professionals. So within adult social care, we run a regular training programme with the University of Birmingham. The challenge with that is it's a 2-year training programme, and we do know that our population of AMPs were an ageing population, so we have lost volumes. The positive news is that ourselves as Adult Social Care and NHFT have been working in partnership. So we've had 2 candidates that as NAS we've supported NHFT in having some of their workforce undertake the AMP training programme, and in turn they then support populating the rota for those assessments to be undertaken. So we've had 2 candidates this year complete their first year of training. They're now moving through to their second year, or what we call stage 2, which is a very practical application of mental health law and shadowing those assessments in practice, which is really positive. We've had another candidate come on to stage 1 who will start their training, and we're also looking at identifying other individuals. So that's a really positive move. It's small numbers, but it's steps in the right direction. One of the other challenges that was highlighted, that the AMP service is currently delivered in 2 separate ways. So as adults, we have a service that runs from 9 o'clock in the morning till 9 o'clock in the evening. And then the out of hours provision for AMP service is delivered by the Children's Trust through the EDT service. So there was some work that we were doing just pre-unitaries and pre-COVID, was actually exploring the opportunities that as children's broke into a trust, was there a potential for adults to run a 24/7 AMP service, but very closely aligned to NHFT's mental health provision, which would give some efficiencies, but also enable better outcomes for people, because there would be much more in the way of alternatives to a hospital detention for individuals. So that work is currently still underway, and obviously with unitaries and the children's breaking into the trust, there's a couple of decisions there that still need to be worked through. One of the other factors in relation to particularly that overnight service and over the weekend is it's not just necessarily the availability of the assessing AMP, it's also having the necessary infrastructure such as your section 12 doctors and your access to mental health beds. So through some of the data that we've been collecting and really looking at potentially what has been causing delays, some of our conversations with NHFT is around whether we actually need to extend the section 12 doctor provision. So again, that's something that we continue to work really closely together on and are exploring. One of the other things that we want to do to get a better service for people is NHFT have a mental health hub that's based within Rushden, and we've been doing a piece of work to look at actually is there some opportunities to co-locate our current AMP provision and locate them within the mental health hub in Rushden, and there's some pros and cons for this. One is that operates in a very similar model to the way that we want to operate in adult social care. So they have first points of contact, people that will talk to people and really explore any of those opportunities to resolve that mental health crisis without looking at formal assessment or detention. Others is that does mean that service is very embedded in the north, and actually if we had people who were being picked up on a section 136 deep in the south, would that potentially cause a delay? So we're just looking at those potential options. Another thing that we've done since the last board, and thank you Nick for putting us in touch with the right people, was that we have explored the potential of looking at working with the University of Northampton around a different model for training AMPs. So as I said, we currently work with Birmingham. It's a very good programme, but it does take 2 years to complete. And again, there are further conversations that need to happen, but they've very much started to have those positive conversations around whether there's some opportunities to do something differently and in collaboration together. So really, I think that they were the salient points. Adam has laid out that there are some financial implications associated with them and some risks that we'll need to consider. From my view, it sounds like we're moving in the right direction. I suppose post vesting day, it's worthy for the board to note that the AMP service in the intervening period will be a hosted service, meaning that the service will be hosted in the North Unitary, but will deliver the service to both the North and the West. I'll stop there in case anybody's got any questions or comments.
Okay, thank you, Sam. Yes, we have Maria.
Thanks, Nick. I was just going to say it's a really helpful report, and thanks, Sam, for presenting it. It's good to see the progress that's being made. I suppose my question was just how we're going to track the progress on this when this board ends after today and moves across to the new structure. Will the action be transferred to both new health and wellbeing boards, or should it be picked up by the Health and Care Partnership?
So, really interesting point. This has come from the Crisis Care Concordat, so some of those discussions are ongoing within that forum, and I believe it's also tabled as an agenda at the People's Board, but we probably would like an action that makes sure that both of the new health and wellbeing boards are cited on the progress.
Well, can we make that action now? Can we record that as an action as a recommendation from this board going forward? Would that help, Sam and Adam? Would that address it, Maria, do you think? Okay, thank you.
Because these aren't particularly quick actions and they take an element of collaboration, would the board think it's appropriate to provide perhaps a quarterly update on progress?
Yep, there's a nod there. Yes, I think that would be good. Thank you. Any other comments for Adam through Sam on this? If not, I can see that. Oh, David, apologies.
That's okay, Nick, thank you. I mean, it's probably just wise to point out that AMP recruitment is a national challenge in that sense. Most health and care systems struggle with recruiting and retaining the approved mental health practitioner workforce. And that's something which I think is something which we're trying to address at both regional and national levels as well, about how do we develop a good pipeline of people coming through who want to work in the AMP services in that sense. So I think it's important for board members to understand that it's not a local challenge, it is one which is nationally experienced.
Okay, thank you, David. Points well made. I can see that Polly is now in the room. Polly, welcome. We could go back to item 12, Kettering General Hospital HIP2 programme. Floor is yours, madam.
Thank you very much. And thank you, everyone. So for those that don't know me, my name's Polly and I'm Director of Strategy at Kettering General Hospital. So board members, hopefully that were here last time I came, will remember that I explained last time that Kettering had been delighted back in 2019 to be named as one of the 40 new hospitals that the government announced, and we were allocated money in the financial year just about to close to explore the different options for what that might mean for Kettering and how we might redevelop the hospital. I also presented last time what we'd come up with. So the strategic development of the site, which board members remember is split into 4 phases. The first phase being a building at the top of the site, which will have a new A&E facility on the ground floor and urgent care, short stay assessment wards, and then inpatient wards above it. So just to say thank you very much for the letter of support that came from this board that enabled us to submit our strategic outline case to NHSI and E. Really welcome that letter, so thank you very much. So we submitted a strategic outline case at the end of February. That's gone into the region, NHSI E regionally. They are currently going through that, reviewing it. We've had some very supportive meetings with them and discussions with them about how we might take this project forward. We are expecting to hear back from them towards the end of April, hopefully with a letter of support, but we are moving straight on to outline business case stage. So at outline business case, and just for those that aren't as familiar with public sector investments, we then, once we've done outline business case, need to move to full business case before we can start construction. But outline business case should take us about a year. And that's going to involve a much greater level of design for both the first phase and the second phase of buildings. So we have started working with our clinical teams on what that looks like and what they think they need. We're also going to be coming out post-April to our stakeholders, including members of this board and others, to start to get patients and other partner organisations involved with the design of that, what they need, because what we're really looking for, and our partners in the HCP are signed up to, is a really integrated facility. So it's not just, it's predominantly, of course, urgent acute care, but actually much more we're moving to integrated care, being able to work with community and primary care partners, mental health partners as well, to provide a holistic set of care for the patients that access our facilities. So we'll be doing some more public engagement and doing some partnership events from April onwards, probably throughout the summer, where we're going into that level of design. In the meantime, what we're also doing is working up our kind of what we call the enabling works. So in order to start construction for phase one, there are a number of different things that we need to do on the site. We need to start to build new energy centre facilities. We're working towards net zero carbon, moving towards much more sustainable energy solutions that we currently have in quite an old estate that's still based on steam boiler plants and infrastructure and things like that. So we're doing some of those things over the next year. We'll be upgrading some of our other facilities, reviewing our car parking and making sure that throughout the construction phase, we've got enough car parking spaces for our patients and for our staff. And we'll be doing some demolition works and rerouting some of the roads around the site. So even though we've got to go through outline business case and full business case, you will actually start to see some work and some construction on the site. Probably in about, we're doing the design of all of that at the moment, so that will probably start at the beginning of next year or at the end of this calendar year. So really that's all I came here to say. It was to thank you for your letter of support, to advise you that we are moving ahead with the next phases of work that will involve lots of design, working with our partners, working with our patients, and you'll start to see some work on the site fairly shortly.
Great, thank you, Polly, for the update. I'm glad the letter went down well. That's a job well done on behalf of the board. Any comments for Polly, other than we wish it well and look forward to seeing the estate develop in the way that they've described? Very exciting, and congratulations for getting the money to do it. Well done.
Thank you, thank you, thank you to all of you.
Okay, let's move to item 17, Northamptonshire Partnership Early Help Strategy and Action. The presenter is Clive Seal. Clive, are you here?
I am, thank you. I am here. Thank you very much for inviting me. I don't know if you've got the facilities to put it on screen, if that would help, or should we just take it that it's been read?
We might be able to. I don't know. Do you have presenters' rights, or is it something that you could do? Show. I mean, it's in the pack anyway, so perhaps you can take it. We've got it a hard copy or on our own laptop. So please just take us through. Thank you.
Yeah, please. So thank you very much for the invite. I'm Clive Seal. I'm the interim assistant director for early help in the Northamptonshire Children's Trust. And I'm really glad to be here to talk about all things the early help strategy and the action plan, what flows from that. And the reason why is because it's taken a while for us in Northamptonshire to understand or really come together as a partnership to work with families at early help and safeguarding level. We know it's the right thing to do. We've always known it's the right thing to do, but getting it in one space is always a challenge. And I think Northamptonshire have done that in this strategy, which runs from 2020 to 23. And what we've done, regardless of strategicness, operational, we've put that all aside and come together and put together a shared, co-produced document which is owned by all the partnership, shared by and operated and delivered in a similar vein. And that's an important step for children and families in Northamptonshire. Now, one of the drivers behind that was very much around, certainly from the Children's Trust, was that in 2019, we had our Ofsted judgment and we were rated inadequate. And one of the things they said about early help in particular was that we weren't coordinated in our services. We didn't share ambitions with partners, and partners didn't understand what are pathways for support to families. And in a sense, we all seem to be doing similar things, but with no cohesion and joined upness. So we really set about with partners as health and schools, the police, community sector, voluntary sector, to think about how best we can coordinate our work and work better and make sure that early help becomes everyone's business, really. Hence, a strategy we had in 2018 to 2020 was the beginning of it, but this one is the particular one where the nuts and bolts have really sort of brought it together. And the vision very much behind it is really about supporting families early. We know from research that if you support families really early, when problems are identified, we stand a better chance of helping them to build resilience and to make sure that they don't need more costly resources at a later stage. So we know all the research has told us that. We know that, in terms of our vision, that if we work together, we reduce duplication within the system. So we make sure that everybody's doing their part, but not doing the same thing. And families have told us this. What they've told us a lot of the times is that too many professionals are coming through their house, giving them information, giving them advice, not in a coordinated way. Some of that advice contradicts. So our vision is really about simplifying the model, reducing the duplication, having that shared operating model so we all coordinate around each other, and we put families and children at the heart of that, and they are partners within the partnership, and that's very key. Families know a lot of the time what their symptoms are, what would help them, what would support them. And in our approach on the shared operating model, it's really about making sure that they have that say, they have that control, they are at the forefront of practice, and the rest of the professionals, we coordinate around them. So the guiding principles very much of the strategy is really about everybody else. Everything early help is everyone's business, making sure that we take full responsibility as partners for the delivery of early help services. And in that, it means even if a family comes to your door and it's the wrong service, we handhold them into the service that they need. We don't sort of say, oh, well, you need to go over somewhere else and so on. We really take responsibility and hold that family, because we know that when families come for support, and it's always difficult sometimes when families ask for support, there's a lot of stigma around it for families. If we don't provide a very welcoming and opening and hand-holding support, we may lose them, problems escalate, and we see them later on needing more costly services later on. So there's an investment in really being responsible for families and making sure that they feel valued, feel that they are being supported, and feel very much that the partnership is working with them, not necessarily for them. So we have our guiding principles around that, and that very much helps us to support and look at families in a way that provides good outcomes for them. Sorry, I've lost my page here. Moving on to very much the action plan. The action plan is really in its early stages, and it's really about developing information and data about what we know. And I'm really pleased the way we've done this, because it's one of the key things of the action plan is making sure that we broaden the network. We make sure that more work is done in the voluntary sector and community sector to bring them on board, because we recognise that there's a lot of work with families in the communities which we never know about, and it's done really well by the voluntary sector and the community sector, and we want their engagement much more. We want their involvement to help shape what the partnership looks like going forward. So part of the action plan is to pull on a wider kind of pool of the community and voluntary sector. Equally, we want to use the data a lot better to help support our work and make sure we are being led a lot more by what the data tell us, and really focusing on areas which need our support more, and where we can put more coordinated partnership resources in. So we're maturing a data approach, so we can pick up on trends in particular areas and understand inequalities in some areas, so we can be more effective as a unit in those areas. And that's really really important, that we develop a partnership data base, so we can use that to help forward our work with families. And then part of that enables us to really plan for the future and make sure that we are mature, certainly as a network and a partnership. It strengthens our systems and our understandings of families. We become more accessible to families. Our pathways are more understood by partners and families, and we really make that experience of early help support for families one that is beneficial, firstly for the families, but also that they feel that if they do get into a crisis in the future again, that they feel comfortable and confident to ask for support, knowing that they will get support. So for me, when we think back of the strategy, I think it will be one of the most important developments we've done in Northamptonshire for children and families in terms of planning as a partnership to work together and making sure that we are coordinated in our work, and making sure that the impacts of our work is really understood, and we understand it, and it helps shape future generations of collaborations. The main risks really around the strategy, if any, is really about if we don't do it and we don't achieve it. There's no indication so far that we won't achieve our targets and our goals and so on. So I'm really pleased about that. But it's making sure that we hold each other to account as partners to deliver on the expectations. And that's what the Early Help subgroup, the development of that is all about. It's about making sure that we hold each other to account, we develop and understand the impacts we're having in the community, and we're shaping the service delivery, the collaborated service delivery going forward. So we meet monthly, so we're really on top of that, but also the strategy and the action plan will be refreshed every 3 to 6 months to make sure, not refreshed, reviewed, to make sure that we, what we say we're doing, we are doing. And it's really good that we come to boards like today to really just highlight what's happening out there, what we're doing, why we're doing it, and get some sort of feeling of if you think it's the right thing we're doing, we think it is, but it's really good to get that sense from the wider community as well as boards to make sure that we pick up on things that are advised and so on. So thank you very much for inviting me here. Happy to take any questions. The actual strategy, I'll send you the link for it if you haven't got it, so that it's something you can promote as well and highlight within your own organisations.
Thank you, Clive. We'd welcome the link, I'm sure. One of the things we've got some questions for you. One of the things we have to agree, though, as a board, is that the the plan that you put forward is the right approach for Northamptonshire and will deliver the right kind of support for children and families who do need it. So with that in mind, Naomi and Lucy. Naomi, please.
Thanks very much, Clive. The way you describe early help goes to the heart of what the ICS and service integration is all about. So when I was involved in this work some years ago, and it is some years ago, and I am not optimistic, but hopeful that these problems that we had have been solved, is the relationship between patient confidentiality and adults and children's services. So adults who use a drug and alcohol service, adults who use a mental health service, adults, particularly women who use a domestic violence service, their children are very likely to fall into early help category. When I was on a PCT and asked a consultant psychiatrist what happens when a woman is sectioned, what happens to her children, and he said, not my problem. So I want to know, are there links across that do not come into conflict with patient confidentiality, where your alarm bells in terms of early help are linked to adult social care, adult drug and alcohol services, adult mental health services, and others? Highest risk to children.
Yeah, absolutely. And I think for us, all the work of early help, the difference between that is statutory. Is all our work is by consent where appropriate. So what we do, we can't work with a family or a young person without consent. So we would always seek consent at the beginning of our engagement. Where consent is not available or is not given, then there's a risk assessment which we need to do to see, is this a safeguarding issue for the children? And if it becomes a safeguarding issue for then that's when it will escalate, because then...
That's not what I'm asking you. What I'm asking you is, if an adult who happens to be a lone mother of 2 children has a serious mental health problem, does anybody let you know?
Okay, sorry, forgive me. I went off on a complete different tangent. Yes, as a standard, in the front door of children's services, we get a referral into MASH, multi-agency safeguarding hub, that alerts us to the fact that a family may need support or that their children may potentially be at risk. And what we ask for is every professional or organisation where they're dealing with children, they do it very well in the hospitals. It's an instant referral to the children's services to notify us of a particular situation. So all that is held within the multi-agency safeguarding hub. Forgive me for going off on a tangent. It's a straightforward question at the end.
Thank you.
Thank you, Naomi. We've got Lucy and then Joe. So Lucy first, please.
Hi, and thank you for your presentation, Clive. I think it's really, really supportive, obviously, of having a strategy that really gets to grips with the underlying issues so that we can identify people who are at risk. And I think it's worth us having an offline conversation about data and risk stratification around that. Yeah. But the question more so at this point in time is, I note that some of the objectives for the action plan are to expand and develop that wider help network. I'm hoping that you're already in touch with people in my team. Obviously, public health commissioning, York 19s, public health nursing services, etc. We've got that sort of automatic overlap, and we certainly have had experiences of where people need more than the universal services we commission, but don't quite meet the threshold for intervention in children's services, that kind of tier 2 area. We know as a system has been a real gap. So I'm really keen to look at how we can make sure that we're utilising our resources to the best potential to try and close that and make sure that we identify people early.
Yeah, I totally agree, and we work really well with some of your staff. I wonder though, and I agree with you, if there is more a need to develop it from a more strategic level, in a sense where it becomes normal practice. Rather, what I feel it is at the moment is good relationships on specific levels, and I wonder if there's just something about how we can bring public health in on a wider sort of level. So I'm quite happy to have those discussions and look at how best we can do that, because I do think public health contribute a lot to the early help agenda, certainly to my service, and it'd be really good if that was shared across the partnership in a really strategic way that we can then manoeuvre into operation and frontline practice as well.
Okay, thank you. Joe.
So one of the areas that has always worried me is about the invisibility of children, particularly while they haven't been attending school. I appreciate some have been attending school, but the majority have not been, and some we know will not be returning to school for a whole host of reasons. And home educated children, I know, have been an area that have caused us concern, have generated serious case reviews, and to say, how do we identify the invisible, the children who are not presented, appreciating there are certain touch points within the 0 to 19 service, but inevitably there will be periods of time where not everybody will be identified, and say, particularly those home educated children, what are we doing to identify those who may continue to be home educated and not be flagged up to services?
There's a number of things, but in particular, two things I want to draw on. We've recently introduced the Adolescents Vulnerability Panel in a multi-agency panel, which looks at children who are vulnerable across Northamptonshire. Referrals can come in from anywhere, and we will wrap around a package there. One of the key things we do look for from schools and the education department is young people, children who are either excluded or not at school, and there's concerns about them. So early help services initially can go in to identify what the issues are, what the problems are, in order for those children to get support. That particular panel started in November. There's also a schools education NCC version of that, which they look at vulnerability for children who are known to them, and that crosses the whole education, including children who elect to be school educated at home. And if there are vulnerabilities that come to their attention through that panel, they get support. They also support into early help. And I attend that panel specifically so we can wrap around education to make sure that children and families get the support there. Also, what we are, one of our biggest stakeholders in early help is schools, and it wouldn't probably surprise you that we get more referrals from schools than any other of our partners, and rightly so, because they are the sort of organisation who see children the most and see families the most, and know when either children are missing school or issues are happening. They're always at the sort of front facing of that. So there are, again, we have two processes: the MASH, the multi-agency safeguarding, where referrals could come in there. Schools could phone up in the same way to the multi-agency safeguarding hub and have a conversation about young people if they want to make sure that, you know, are they thinking the right thing? They can get guidance, support and consultation on that, and also support from my early help staff, who will then go out and make inquiries with the families if need be. So there are pathways to make sure that we do capture young people and families. In particular, I do say, and I totally agree with you in terms of elected home education, sometime, and my experience of managing the service in the past, they can be the forgotten sort of children. And it's really important that those where we do reviews on those children, if there are concerns that the high, you know, what come from those reviews, that, you know, early help and education departments wrap around those families to support them and make sure they get the support.
So I think you very elegantly described the situation both for schools and for where problems have already been identified. That level of surveillance, I haven't heard anything about more surveillance, more identification of those problems that are hidden. That's still an area of concern, and I've not heard you describe at the same level of surveillance for children, which I appreciate may not be there, but I just think that may be potentially, from what I've heard, an increasing population, and I think should be something that that we're all bothered about, given serious cases. You may not have the answer, but I think it's about the unrecognised, not the recognised, which you've elegantly described.
What I will say, and I think you're right, it is a developing picture. But what I do know is in recent weeks, I've had a number of conversations with a couple of educational trusts in East Northamptonshire around exclusion and inclusion. We're putting on in the next couple of weeks some workshop events, multi-agency workshop events, to talk about those children who are excluded, if you like, or not seen, and how best we can include them. So I think you're right, it's a developing picture, but it's hopefully reassuring that we are starting to pick up that picture, and all the right people are hopefully going to be around those tables to really sort of put together a plan of how we support those who are unseen.
Thank you. I guess just quickly on Joe's comment, this won't be something which is just Northamptonshire based, it'll be across the country, won't it? So I guess what can we learn from what's going on elsewhere about this real problem of children being homeschooled and kind of off the radar? I think Joe's...
I mean, one of the things, I mean, when I was in Richmond and Kingston, I was responsible for education welfare and elected home education. And one of the things, because the legislation around elected home education is a bit woolly, and it's left to the local authorities to really administer it in the way that they feel is suitable for their local authority. One of the things I did was there is a review process for children who are, you know, home educated, and I increased that to 3 times a year, and I brought in dedicated specialist workers who were educationalists but also had a safeguarding background, so they could, you know, detect and identify if families, you know, who chose to, you know, home educate, that they still had the support and so on. And we put together a sort of an information pack of where families can not just get support, they could do activities, etc., so the child's still getting a broad experience, education experience. And it's something like, but that was left to that particular local authority. And I think you're right, nationally I think we're all doing different things, yeah. And there needs to be a very collective sort of conversation about how best we support in a very unified way, and that's yet to be done. Hence why I think boroughs, local counties and so on are sort of highlighting it now and doing their own thing, but we're still waiting for some, I think it stems, if I'm really honest, for some good solid guidance and legislation that helps us and tells us, if you like, you know, gives us guidance as to what to do in a really clear way. And if you go back to the legislation, you know, the Education Act, on that particular bit, home education, it's very woolly and very unclear.
Okay, thank you. Difficult one, but important nonetheless. Ali, you've been waiting patiently.
I have. Thank you, Nick. Clive, it's great to see your passion around this. Just a couple of things. You've mentioned strategy, and clearly there's progressive work happening. I just want to check back in that you're aware of the Children and Young People's Transformation Programme that's being led by Cathy Hadley, because we're trying to bring all of the various strands of great work across Northamptonshire together. This was one of the key 4 priorities for the partnership in the ICS I referenced earlier on, and it was comes through on the back of the Children and Young People's Summit. So I just want to check, I know you're asking today for some support for the plan and strategy, but it's got to connect into everything else. So can I just check back with you on that point?
Yeah, Cathy, as you probably might know, as she probably still is my boss, Cathy, in one sense, in the wider sense, as Director of Children's Services. There's been initial conversation, I must admit, and not a really strategic one where we're aligning ourselves. And I will aim to, as Cathy sits on the strategic board, Safeguarding Strategic Partnership Strategic Board, and we feed in, the subgroup feeds into the board. So we are hoping that we will get representation with Cathy to really bring that to life with us in the subgroup. So it's all joined up. It's not joined up at the moment. I totally agree with you if that's what you're saying, and I think you are, and it needs to be.
Yeah, well, one of the recommendations we need to look at is to make sure that it is joined up through this or whatever board follows. Naomi, yes, please.
Just very quickly, and it's really not about the early help. It's a general point about hearing about early help and hearing about the Children's Trust Board. Our discussions about children have largely been about children at the high need end of the spectrum or medium need end of the spectrum. And I just think it's important to remember that there's all children, there's children living in poverty, and then there's children with very complex problems, and that they do overlap to some extent, but it's very, very important that we don't lose the sense in a public health sense of what we're doing for children. And my second point would be about the language of families. And certainly it is my experience that strategies have to be differentiated between mothers and fathers. Otherwise it's mothers, and it's mothers getting blamed for everything.
Clive, did you want to come? That's a very strong point. I'm not sure how long we've got to discuss this, but just briefly, if you can.
Yeah, I think that's a very good point, particularly about parents. I'd be not telling the truth if I say that when we talk about families, we do tend to think about mothers. We're very clear in the trust and that all reports, everything we do, everything it should include parents and fathers as well, and equal responsibility. That's not always been the case in the past. I think historically, parents, mothers have felt the brunt of conversations. And you're right. I think we need to be explicit across lots of strategies when we talk about families and be very clear that we're including, because in a fathers group that we also have initiated in the trust, fathers have said to us very clearly they feel marginalized. They actually don't feel part of discussions. They've given scenarios of when professionals have come to their house and spoken to mother and child and not necessarily themselves. So certainly, it's for each agency to really make sure that they're including the wider family approach, and they're really valuing fathers who play a very good role within the lives of children, but it's not always recognized during engagement. So yes, that is something, and that might be a really good further recommendation. I'm happy to take back to the subgroup to say, it's something where as a board you felt was strongly we should just make clear that our work should be seen transparently across as the whole family as opposed to sections of it.
Yeah, I think that would be very helpful if you could do that, Clive. I've got Toby and Ali, your hand is still up. Is that a legacy hand? Anyway, Toby, over to you, then we'll confirm.
Yeah, thanks, Chair. It was just a very brief comment, having listened to the conversation about the recommendations that are with the item. There's clearly some really good work underway here. So firstly, to echo what others have said in welcoming the visibility of this, and it speaks to and focuses on one of our particular kind of priority areas both as a Health and Wellbeing Board, but also from the wider ICS and partnership perspective. So my suggestion, Nikki, on the recommendations, it feels to me, I think Clive acknowledged this point about connections and to what extent things at the moment do or don't connect together on this agenda. I'd like to suggest that there's perhaps an additional recommendation around asking Kathy, in terms of that lead role from the Children and Young People's Workstream on behalf of the Health and Care Partnership Board, to pick up probably with Colin and Alison. I know the three of you, Ali, have already been having some conversations in this space to work through how we get the visibility and the connections of these areas into that overall Health and Care Partnership priority programme as well. So it's a kind of an and rather than detracting at all from the good work that's here so far. But I think there's a number of people have acknowledged that, including Lucy's comment around the links into public health. So I think it's about how wider partners can support even further, Clive, to move this forwards. So I would just suggest that as an additional.
I think I've picked that up very clearly from several of you, and I think that's right, and it's good. It shouldn't stand as an isolated document. It should feed, and the group, it should feed into a number of agendas so that they're all connected. I absolutely agree with that, and that would be a really good recommendation for us to take on board.
Okay, thank you, Clive. So we're asked to approve, the board's asked to approve, 6 recommendations now. So we'll just go through them very quickly, continue with the high-level briefing sessions for promoting early help, the early help operating model, ensure that action Planning continues to progress the key priorities, ensure that there's a strategic oversight of the risk areas. You mentioned that, and I think the Health and Wellbeing Boards moving forward have to take that on. Continue to embed the operating model through practice and workforce development to ensure that we seek yearly feedback, maybe it's more than yearly, from the residents that we serve. And the last point that Toby made, something around visibility and being active in driving the connections and monitoring those connections to make sure that they're working properly.
Yeah.
Yep, are we happy with that? Thank you, and thank you, Clive, for a great report. We can move on to item 18, which is the Northamptonshire Health and Wellbeing Board annual report. So we have to do one of these reports every year, folks. The draft report for 2021 is in progress, but it's not completed yet. So as this is the last meeting of the board, I'm asking for permission from you to sign off the report following virtual consultations and approval from board members, if you're happy with that. Okay, thank you. Nods all around, very good. Right, 19, any other business? That great point in the meeting when you can say any other business. No, it's been a good meeting, folks. Lucy, yes.
It was just really to reiterate Councillor Golby's comments before. Obviously, I've worked really closely with you over the last, 18 months, 2 years that you've been chair. It's been really interesting and I think very helpful during obviously what's been a very political time for all of the councils across Northamptonshire to have, a sort of an apolitical independent chair, bringing the university in and the university's contribution as well to the pandemic response. I think that hasn't been mentioned and it must be, has been extraordinary, but it's been a pleasure to work with you. Thank you so much for your support. I know you're obviously hoping to remain involved with West Northamptonshire's Health and Wellbeing Board going forward, but just really wanted to reiterate Matt's thanks on a personal level, but I'm sure on behalf of others as well. So thank you.
Thank you, Lucy. So just briefly then, take home messages. I mean, I'm overwhelmed really by the positive contributions from everybody that summarised the direction of travel of the board. I mean, over the last just couple of years, how challenging it's been, not just with the political dimensions, but who would ever have thought, that we we're going to be facing a global pandemic? It's just astonishing the way that not just Northamptonshire, but I think the country's pulled together. So I've been involved with the board since 2012. I was on one of the shadow board members. So that's well, it's a decade, and I can probably say I'm only just starting to understand the healthcare economy after 10 years. But it's been a great journey for me, and I'm really enjoyed being part of it. I think we've seen a fundamental progress towards integration of services, which is really welcome. And in a strange way, you think about COVID, it's been a springboard into absolutely walking the talk in terms of integration. And I think that, that there's successes going to come out of that. That's the silver lining behind COVID. And bluntly, it's ours to lose now. With the direction of travel is set. So it's down to us to make sure it's going to work properly. I mean, it's been a pleasure and an honour working with you all. And also, as an outsider, to be blunt, I don't have a political agenda. I'm not a healthcare professional. So thank you for the trust that you placed in me to allow me to chair this great group. And as Lucy said, I do hope to be involved in some way, shape or form as the unitaries move forward into the new structure. So anyway, so good luck with it all. And I hopefully we'll see you all in the flesh not before too long. I look forward to that. So thank you very much. Great meeting, and see you all around.
Thank
Cheers.
you. Bye.